Hi there, I'm Betsy Vick, and I am going to finish up what Amanda started about the affirmation for medical marijuana use in the U.S. I will continue with question E. How well have past efforts been at solving the problem? Until the 20th century, marijuana underwent a ban for almost 60 years until California passed Proposition 215 in 1996. Since then, marijuana has undergone an important resurgence and has progressively gained approval, acceptance, and momentum. In the early 2000s, the medical marijuana argument was once again a hot topic, and once again it was shot down, like it has been so many times in the past. The proponents praising its benefits and little to no side effects, while the adversaries argue they just want to legalize it to get high. Marijuana has been classified as a Schedule I substance, which is an illegal drug, since the 1970s by the DEA, simply because of a letter written by Dr. Egberg. The doctor wrote a letter stating that there was a considerable void in our knowledge of the plant and its effects. Therefore, it should be considered a Schedule I, which is an illegal drug. Because of the absence of research, the plant has remained a substance I, as well as it is well past the time that it should be changed. Research now shows that many medicinal benefits and little to no side effects of marijuana in treating, just to name a few disorders, seizures, symptoms related to cancers, PTSD, chronic pain. The ANA acknowledges in June 2005, the U.S. Supreme Court ruled 6-3 that the federal government has the power to arrest and prosecute patients and their suppliers even if the marijuana use is permitted under state law because of its authority under the Federal Controlled Substance Act to regulate interstate commerce in illegal drugs. Who are the stakeholders? Are they the patients, healthcare providers, hospitals, society? The stakeholders for legalizing marijuana, they're far-reaching. It isn't just the doctors, the pharmacists, or the hospitals. It includes society as a whole, as well as law enforcement and the government. Patients are left looking for a similar source of the product and are left unprotected. If marijuana is legalized for medicinal purposes, then that could increase tax revenue, it could decrease demand on law enforcement, the potential for less crowded emergency departments due to patients seeking pain relief. Per Jeffrey Myron, who is a professor of economics at Harvard University, he states marijuana legalization would also generate tax revenue of $2.4 billion annually if marijuana were taxed like all other goods, and $6.2 billion annually if marijuana were taxed at rates comparable to those on alcohol and tobacco. The savings in state and local government expenditures that would result from marijuana legalization consist of three main components: the reduction in police resources from the elimination of marijuana arrests, the reduction in prosecution and judicial resources from the elimination of marijuana prosecutions, and the reduction in correctional resources from the elimination of marijuana incarcerations. There will still need to be a regulatory body, and although marijuana is profitable, it is not the slam dunk that most presume it to be. In conclusion, there are many stakeholders that share in the responsibility in the distribution, profits, and regulation of marijuana. Patients like Clint Jasons from South Carolina share a similar feeling. He says, quote, medical marijuana might be his last hope. He feels like he would be suicidal. The feeling like I can't escape the prison of my own mind, he says. Diagnosed with PTSD a year ago, he's tried nearly everything he can think of. I've tried 12 different medications. None of them worked, explained Jackson. He wants to be able to get marijuana legally to try and make his life normal again. Question G. What solution do you propose, for or against, and why? Well, we are proposing for. the use of medical marijuana. In most of the articles we read, the main concerns about the use of medical marijuana was the proper distribution and handling of the drug. Here are some reasons that we could put in some of the proposals we could put into place to maintain proper handling of the drug. Regulating and legalization of medical marijuana can reduce the exposure to more dangerous drugs on the black market. Restricting the sales to licensed stores, reducing consumers' exposure to harder drugs. Legalization ensures that consumers know what they're getting when they purchase marijuana at an authorized store instead of the unknown on the black market. Regulating marijuana like alcohol would eliminate income, violent, and turf battles associated with the illegal sales on the black market. All sales would be subject to state and local sales tax up to 15% on wholesale sales on non-medical marijuana. Question H. Are there alternatives to your solution? Why not use those? There are several alternatives to the use of medical marijuana. But first we need to determine why the person is using the marijuana in the first place. Most of the time it's due to chronic pain, due to disorders such as glaucoma, suppression of nausea, antispasmodics, anticonvulsants, indications for neurological indications, epilepsy, MS, and those are just a few of the conditions. The use of current medications such as opioid painkillers, acupuncture, chiropractic manipulation, herbal supplements, vitamins, they can help. Therapy to help patients deal with the pain, they can all help, but they can't help like medicinal marijuana can help. There are several reasons why not to go along with the alternative. Many medications and treatments used are very costly, and they do not work with everyone, and everyone does not have the same outcome. Data gathered from 1999 to 2010 from all 50 states shows that opioid overdose rates continue to climb across America. However, the numbers climbed much lower in those states with the medical marijuana laws in effect. These states had 25% fewer deaths from opioid overdoses. I think that speaks volumes on the need to legalize medical marijuana. Question I. If your solution were initiated, what might need to be monitored to see if it helps solve the problem? Many times it is a hard area to control due to the fact that even though the state has legalized marijuana for medical purposes, the state still has laws for illegal marijuana use. With some of these suggestions, it would be easier for the state to monitor growers, dispensaries, and eligible patients, instead of there being so many gray areas. The first suggestion would be state laws can be put into place to maintain proper growing and dispensing. Strict list for what conditions are eligible for medical marijuana use. Put caps on the amounts of marijuana a patient can possess at any given time. Limit the number of pharmacists who can distribute the drug. States should initiate a patient registry. Growers and dispensaries are limited to a certain number of plants or products per medical user, and issuing identification cards to patients who qualify for the drug. Many of these suggestions have been put into place in the states that do currently use medical marijuana, and they have been successful, and the patients do have successful outcomes, and they are living productive lives, and they are very thankful for the opportunity to have the medical marijuana, and that in itself is a reason to approve the medical marijuana.